So first I'll speak as a pediatrician and a clinician. I know as a fact the safety and well-being of our pediatric patient population, I believe the entire national population, is better in the hands of an independent, we don't even have to use the word independent, physician-owned, physician-controlled, and in this case pediatrician-controlled practice, not only from a patient safety, not only from a patient outcome, also economical costs. We are cheaper than the big corporate-run, executive-run practices and hospital systems. So from all of and the patient experience, there's no comparison between the patient experience. And being on both sides, I can tell you, is when the pediatrician owns, or the physician owns the practice, that's what makes the difference. Patients before profits. Numbers are important. Some wonderful people, and I one quote have said, without a margin, there's no mission. And that's a great quote. And we need that quote because we need that margin to have the mission to grow. But it's patients before profits, no matter what. And the other side of the aisle, there is no doubt that it's not patients before profit.
Maintaining independence is our practice owners' utmost priority. There are a lot of concerns of infiltration of big systems coming in and losing that individual patient touch and that individualized care through having repeated exposure from your primary care physician. Being able to have a medical home where you know what you're going to get when you get there. It's how you feel, it's how you walk away knowing that you have an answer at the other end of the phone, and that portal message is going to be answered by your PCP or their team, and it's one specific voice that's coming back to you with sound medical information. Most importantly, in a big hospital system, one can feel lost. In an independent practice, it's our primary goal to make sure that each individual family feels seen and heard and tailored care to their family.
And I don't want to speak for the other side of the aisle too much, but if you're owned by a pediatrician, if the pediatricians are invested in the practice, pediatricians care about patients in general, but when there's other agendas and other items and not motivated to really serve the patient in the community, then patients won't always be able to get in. So the motivation of being the medical home is key to health of our community, is key to a success of a practice. So being the medical home, that means when you need to get in, you can almost always get in, and very often to get in with the clinician of choice. If you run by a pediatrician, if you have a pediatric-centric or pediatric-based platform EHR that works together with you, you're going to get that patient in, you're going to be there when they need it, you're going to avoid that urgent care emergency room, especially from a well-being, outcome, and cost.
As a patient-centered medical home, it is a pillar of our practice to really reiterate to every single patient, please do not go to the ER, please do not go to the urgent care. They don't have your information. They don't have your long history of whatever your chronic concern is. They don't know you as well as we do. Please call me first, or provider X will be on call tonight. Please don't go to the ER or the urgent care. Call us, we can help you. We can avoid those costly visits and a lot of unnecessary time that's wasted in some of those other facilities.